Hi, we're going to take a quick moment to review best practices for communicating virtually. First off, body language is key. Remember, it is very hyper-focused because you're presenting yourself through this small box. So everything is a bit heightened. So you really want to be aware of what you're showing within that small box. Next, make sure to angle the camera appropriately. Sort of the top half of your body should be within your frame, and try to keep your camera around eye level. You also want to think about lighting yourself from behind the camera. Be aware of windows and backlighting. So if you had a window behind you, you might just turn into a big shadow. So kind of have the lighting from behind the camera. And then really try to look directly into the camera. I know that is really awkward and uncomfortable, but that'll make the other people on the other side feel that you're really connecting with them. This is particularly important when working with clients and patients. If you need to, put little pictures of people next to your camera to help you connect. Really try to establish rapport immediately through a smile and quickly making a connection with the person. You also want to think about keeping your background environment professional. Make sure what is showing in your window is appropriate. A professional appearing environment can help create a sense of security, especially when working with clients and patients. And with others, sometimes you can put in a virtual background, although those can be a little shifty at times. But just a blank wall somewhere can help, or you can throw up a sheet somewhere on a wall so it's just a white background. But it can really kind of help give a sense of lack of distraction for others and focus on the people as opposed to what's in the back. When you're connecting virtually, really try to maintain that empathy though, making that connection with others, being understanding of what the other person's situation is. If working with a client or patient, try to really connect with the story of that individual and really focus on observing those emotional cues. We have to be a little more hyper aware when reading the emotional cues of others. So really in tune. So you do need to look at the camera, but then at times, obviously, you do need to look at the person's picture. So it's this kind of balancing act of both camera as well as person, so you can be reading what they're offering you. And usually when you're speaking is when you can direct it to the camera. And really force yourself to be present. I think right now, when you're doing more virtually, it's easier to multitask. It's either easier to be checking something on your computer and doing something else, but that really does take away from that connection and being present virtually. An important thing also to note is when you do something, say you have to check something on the computer, acknowledge what you're doing. If you're taking notes, typing something, let the others know so that it's clear and they don't think that you're not paying attention to them. And then really try to apply those active listening and yes and practices when you're talking with others and communicating virtually. Those are just a few little tools that you can use to help improve your virtual communication skills, be it with colleagues, friends, professionally, or a client or patient. Enjoy. Thank you.